Dr. Christensen, I made a joke about allergy and sharks, kind of like what do we do when people are allergic to shark bites. But in any case, Hawaii being a very open field, and I'm sure there's lots of flowers and stuff, and then you have the, maybe you even have some of that volcano stuff. Anyway, lots of people have allergies around the world, and frankly, I sometimes don't get it that, people take allergy medicines, before they go to the forest. I always thought forests were, healthy and good. But in any case, allergy, tell us maybe there are different type of allergies, and tell us how you cure allergies.
Well, allergy in the Western sense is like histamine reaction. They have acute problem when you come in contact with, let's say, the milk. They have an allergy to it, so they will have a breakout skin rash, or some people have diarrhea, or people have allergy to the pollen, and they will have a hay fever. You heard about hay fever, everyone knows. These are all histamine reaction. They actually are able to identify the immunoglobulin, IgE, that attack the mast cells. There's a pathophysiology explained very well how the histamine secrete, and then you get the vasodilatation, you get swelling, you get wale all over your skin, you're swelling in your throat close up, you can't breathe. That's acute allergy in Western sense. And when you have the problem, they will treat you cortisone, or give you cortisone on the skin, or give you antihistamine. They have a cure for that. But when you come in with people cannot take cortisone for a long time, or people have problem with the histamine, then they will say, okay, just don't eat this. You heard about the allergists say, eliminate the bread all the time. Don't eat milk. Don't eat cheese. So they give you the elimination spill, and it gets very difficult for people to live in an eliminated diet. Some people couldn't even eat anything. They give in skin and bone. And I have a little child was born to her allergic to everything. So she's 3 years old when she came to see me. Her skin was like alligator skin. She's scratched all the time. You know how baby skin are? They are very smooth and beautiful. That girl has alligator skin. That's all scratched and very, very painful. And she's also cannot grow very well because she take cortisone forever. She's only 3 years old. She's going to take cortisone for the rest of her life. That's not the way to live. So I start using this technique that will reprogram her brain. And the way we do it is to identify we follow the protocol. It's a step-by-step, very, very methodic. And it's a learnable technique. It's repeatable. And I've been doing this for 18 years. And then we do that, reprogram her brain by acupressure the spinal nerve that come up from the back of your back. And we do the acupressure on that to reprogram your brain. And then she is able to eat those food. You don't have to avoid that. And this technique is very powerful, and so she was able to eat. The first thing happened to her is that mother called me and said she became an angel. It's not only she has allergy to food, but she was also very nasty. Her mood, her behavior was very antisocial. She pinched other kids all the time, and my first treatment, mother called me, couldn't wait until next day. She said, you have to see my child. She's an angel. She shared her toy. She hugged everybody. Everybody just astonished. And I was a little bit shocked too, because I was treating her full allergy. I didn't expect her behavior change. And I started to realize, yes, this is really amazing. Your body take its own precedent. Whatever needs to be healed, her behavior heal first before her food. So this technique goes along with in sync with your body, whatever that it's set its own. but I apply the technique, and that will follow, and it's reprogram your brain, rewiring everything. And so that was a full allergy, but then her relationship with other kids are better. So this go on. I have many stories for children, for adults, for ADD children, for depressed adults.
Is this girl still on cortisol now, or were you able to take her off?
I haven't seen her. That was like 15 years ago, and I moved to Hawaii, but I know that she got better. She's eating regular food. She's not on cortisone, and she still has some of the issue because I haven't finished all of that, but she has a dramatic difference.
Right.
And there's another 11-year-old boy. He came to see me when he was 11. Now he's 18, and the same thing, that he has many allergies too, and he had to bring his own little food with him when he go to party. He cannot eat the party food. So after I treat all of this, he was able to eat egg products, the milk products, and all other things, the grains and wheat. These are all, the party cakes. They make all of that. Now he is able to eat that. And he wrote me a letter, thanked me for taking him out of prison. He literally lived in the prison of food allergy. So now he's 18 years old, and he's in the college, and he is really happy who he is now. He's just eating normal. And that was, I haven't seen him for 5 years. I talked to Mom because I moved to Hawaii, and Mom said that he's still good. And I'm still doing the treatment for his mother. A distant healing. So there's a lot of things, and including the allergy to, I don't want to use the word allergy to person. I would say energy incompatible with a person. For example, when I have a lady that had a problem with her father, who's already deceased, and his negative energy is still with her, so she caused her a lot of physical illness and chronic fatigue, fibromyalgia, and we followed the protocol until we've get into her father's issue. I had her father's picture and treat her father with her. And so that also cleared that issue, and she felt so happy with that. And there's a lot of untold abuse issues can surface when we're doing this technique, because we always deal with the emotional blockage. And a lot of people, when that issue is right time, it's not always they showed up, but they want to show up. It come up in the right time, associate certain food, it will show up, and then they will talk about it. And I hear several never told stories, abuse issues that hidden away for so many years. They start servicing, and we treat that accordingly, and they cry, and done. Okay, so they get release it, and then they don't have any blockage anymore. So this technique is not just allergy, it's for energy incompatibility.
Well, maybe allergy is kind of an energy incompatibility, for some one way or the other way.
Yes.
So basically, you're not healing allergies with, medicine towards it, or with don't eat it. I mean, people probably won't eat it until you have cured it, but then it just simply gets better. So, and adults react to it as well, because a couple of your stories, they were all about young people, but adults react to it
yes.
As well.
Yeah, yes. Well, I have a lot of adult patients that currently going through the allergy elimination process. We are doing the treatment, so they can eat those. There's a lot of chronic fatigue, fibromyalgia, and many other pain issues, insomnia, depression, migraine headache, are all associated with the food that they are eating and blocking the channel. So when we are using this technique, you can clear their headache. You can clear their depression or insomnia or other illness they have, especially like irritable bowel. They have diarrhea or alternating with the constipation, and or the stomach problems. They have a esophageal reflux syndrome, or like diabetes, they have a problem with the sugar. They cannot metabolize the sugar or metabolize with the cholesterol. So those are helping for the heart disease or diabetes, and also helpful for the weight loss. People have problem, they keep gaining weight because they have a problem. Every time they eat food that they block them, and they feel like they have to eat more because they didn't get enough. Every time you eat, the more you eat, the more blockage you have, the more you want to eat because you keep thinking, I don't have enough. So they have this continuous eating habit. Once we clear that, then they will metabolize. Once your brain knows this thing, your brain will say, I have enough. Don't give me anymore. So then you will not eat that much. But some people are having so much weight because they just keep eating. They have no stop. So that's incompatible.
Right. Well, there's a lot more to talk. We have insomnia to talk about. We have weight loss to talk about. We have fibromyalgia to talk about. That's a really big one. Lots of people, have that, type of thing. So we have plenty of more topics. Thanks for your candidness and for your very informative session here. Thank you very much.